From the Chronicle podcast system, this is the August 9th episode of SLP. SLP stands for Shear Listening Pleasure, featuring your host, Neil Shear. In each episode, Neil offers his opinions and comments, and speaks with his guests about dermatology, and, sometimes, one or two other passions. Support for the SLP podcast is provided by Leo Pharma Canada. Neil's guest today is Dr. Irina Turchin, a community dermatologist in Fredericton, New Brunswick. If you have a question for Neil or his guest, or want to be in touch at any time, just send an email to slp@chronicle.org. And if you attach a voice clip, we might even use your question on an upcoming episode. And now, here's your host, the derm boss himself, Neil Shear.
Well, hello, dear listener. This is Dr. Neil Shear, who's now a retired dermatologist and has held many positions in dermatology in Canada. I've been very impressed throughout my career with what my colleagues have done in bringing good dermatologic skincare for some very serious diseases, especially across Canada. And I've taken the opportunity to interview people and hear how they got, where they got, and what the impact is that they're making in their community. And today I'm absolutely thrilled to have Dr. Irina Turchin, who's in Fredericton and who is going to be chatting with me about how she got where she got. It's very underserviced across Canada for dermatology, and certainly in more, if you will, isolated areas like Atlantic Canada. But the group in Atlantic Canada are just fabulous dermatologists and people, and the community I know there respects them. So Irina, thank you so much for taking time from your busy clinic to speak with me today. And I guess I'd just like to start, if you could just tell people what is dermatology in Fredericton, New Brunswick about?
Thank you very much, Neil, for having me. It is a real privilege to do this chat. So Fredericton is a small community. I'm the only dermatologist in Fredericton. I'm actually on vacation this week, but we call it not vacation, a slowdown, because some of us are still in the office seeing clinical trial patients. And I grabbed a pack of the pathology reports and I found that there are 5 patients with newly diagnosed lupus and a few melanomas. So we still kind of working on vacation. And I think this is reality for most of us. I enjoy dermatology. I had always wanted to be a physician. I actually knew that I wanted to be a physician since I was 3. And building up on this, through the whole school, and I did nursing before I went to med school, moved to Canada, did Bachelor of Science, did a bit of research in the basic science in the lab. And then got into med school and was very fortunate that we were having this opportunity to do shadowing while in the first year of med school. And I shadowed many physicians and different specialties and family medicine physicians. And I really fell in love with derm. And I was in a clinic with Dr. Tomenta, Stuart Adams, and Derek Woolner. And I spent pretty much all of my free time from med school in that clinic. And they were an amazing group. I learned a lot and they were super supportive. What I just carry these great memories to this day now.
When you come to Canada, how do you go from where you were and you're beyond the 3-year-old images, but when you're, really working there and sort of learning so much about dermatology, what is it like entering the Canadian system to become a dermatologist for you?
It's a story in itself. When we decided to move, we had to interview at the Canadian Embassy. And at the time they said, we don't need nurses, we don't need physicians, we have enough physicians and nurses. So moving, in my head, I was thinking, well, there are different opportunities. We'll see what happens and go from there. And when we moved to Edmonton, and it was economic decline, so there were no jobs. So I was trying to find a job, like any job, and it was quite a bit of struggle. But fortunately, a few months later, I was able to enter university and was really, really lucky in many ways. And then it was one thing after another. I always say, well, take your opportunities when you can, keep your doors open. And when you have to bang your head against the wall, do it, because eventually part of the wall will collapse and you will walk through. So, many amazing people on the way that helped me. When I did basic sciences at U of A, and then helped me to get into med school. Looking back, I only have great memories.
I really appreciate that. It sounds simple when you say it, actually, but I know you really had to run, I think, all over the country, just trying to get a footing, if you will, and some start. And I would just, for listeners, don't recognize they actually do bang their head against the wall. So we have to put that in, I think, as a potential health warning. Other than that, one of the other things that I've always been interested in Canada and tried to do a lot when I was president of the Canadian Derm Association was develop a linkage among rural practices. And the idea was that there are some learnings. People do some things, but there's so many now. There's so many people out there in different rural settings as opposed to the university setting. And it's just amazing. But I just think just so many things they could learn from each other. But how does this fit in with you, say, for among your Atlantic Canada colleagues or others? How do you share ideas, or do you get a chance to discuss cases?
The Atlantic Canada, it's small state group, and it's extremely supportive environment. And, coming to Atlantic Canada, it was just really a blessing and a huge opportunity and a lot of luck. I had returned for service agreement and ended up in Bathurst, New Brunswick. And eventually Dr. Hansen invited me to move over to Fredericton. Again, just I think sheer luck. And I've been here so many years later, and I'm not planning to move. I think it goes back to everybody is extremely supportive. We have the Atlantic Provinces Derm Association meeting every year. It's been on hold during COVID because it's hard to do it virtually, because it's such a more face-to-face meeting and we share cases. But also, there is a lot of exchange of ideas in the meetings, and even, in industry meetings where we can, chat and kind of throw back the ideas. And also I'm never afraid to pick up the phone and call someone. I always call a friend moment, where you can call a friend, you can text a friend now. And I do it quite often, actually, still, where you can say, hey, I'm seeing this. I'm alone, right? I don't have anybody with me. So, and sometimes it's so important just to have another brain to look at something and maybe in a different way, or say, yes, you're right, go ahead. And I still do that. In my first probably 5 years, every few weeks I was emailing or I was talking to Mark Boursier, and he always been super supportive. Cannot say enough of great things about him. And he's still to this day extremely supportive of me personally, and I think everyone in New Brunswick and Atlantic Canada. But then, I have friends as well from residency across the country who we've been throwing ideas. Again, so easy, email, text, phone. Now there's Zoom as well. So I think that you just have to be out there and be open to talk to other people, and really not to be, sometimes we feel intimidated that, I should know this, but I don't know this. But, that's life. So you ask for help. That's what friends are for.
It's interesting with this time now with COVID, how on one hand, you can't go to meetings like the Atlantic Derm meeting, which is wonderful, face-to-face and nice meals, and see the trainees giving presentations. It's just, maybe try and recruit somebody to work with you, that kind of thing. You can't do that. On the other hand, you could have a journal club every night if you wanted, because there's so many possibilities of what you can do. And especially Zooming, for example, has certainly made a big difference. So I don't know what it's going to look like when it clears, but I think there's a lot of things that we've learned that we can do better. Are you doing virtual assessments in New Brunswick? Are they funding that if you can do a virtual assessment?
We are quite fortunate. We do have government funding for the virtual visits, but I find it extremely challenging because you're really limited with the information that you're getting during these virtual assessments. And I have, stories where, you would get photographs of, psoriasis, and then, all of a sudden you see a little abnormal black macula and then think, oh, there's something there. Why didn't you come in? And the person comes in and it's melanoma. Now we're actually in green now. So we are moving forward, hopefully away from COVID for now. I'm not doing much of the virtual work now, only for some patients in nursing homes where it is a challenge to get to the office. And I do see many patients now where, they come for something else. And then I do find a lot of skin cancer now. And I do find that a lot of patients, they come in and there's several concerns that they've accumulated over the COVID time that haven't been addressed. So I think that it's going to be a bit of a challenge in the next several months where we need to move on and provide the care and support our patients, moving perhaps away from the virtual world where they could not see a physician face to face and kind of get back to normal.
That's really interesting. And are you finding now that you're getting into a green sort of area, are your numbers still quite down compared to what they would have been in normal times?
I don't see the pre-COVID volume of patients. And you know what? I actually like it. I do find that, I spend more time with patients, and I really feel that they need that time now more than ever. And I do take more caution now because I feel that these patients haven't been seen for so long. So I find more melanomas than I used to pre-COVID, just because I feel these patients haven't been seen by a physician. So nobody had listened to their chest and found that melanoma on their back. And also, I do find that a lot of skin cancer is found by family members where they see something abnormal. And now that these patients are not exposed to the family, especially elderly patients, they're alone and they're very isolated. So when they come to the office, one, they want to chat for many social and mental reasons. And fortunately, I do have a little bit of more time now, and I have nursing staff to offset that as well. But also there is tremendous medical need to look after them. So I kind of enjoy having a bit more time and seeing a bit less patients.
That makes a lot of sense. And it's a luxury to be able to do that. Often the funding is so low that people can't do that. But at least if you can, it's certainly good for your soul to feel that patients have time. Now, you do clinical trials, and you're very up to date and respected across the country for systemic therapies and those kinds of things that we're getting into, have been for years with biologics, new things coming with JAK inhibitors. Do you feel you need extra time now, or using that extra time to help people try to go from whatever they're using for psoriasis or eczema, for example, and getting them into the right place? Is it easier now that you have the time to do that?
I find that we certainly have more options now, but I can't say that it's necessarily easier or harder. I think it's just sort of a different way to approach things, having more options. In many ways, it's kind of easier because once you clear someone's skin and improve their quality of life, the consequent visits are quite easy in terms of the workload. But it does take time often to get these patients into a right state of mind to try new therapies. I do find that there is this tremendous burden on quality of life with the skin condition. So in a way, it's easier to have new treatments, but in a way, we need to move people from the old thinking that skin disease is not important. It's just a rash. And, but it is important. And we need to move them into the new state of mind where it is important. Everybody deserves to have the care and the quality of life.
Are there things that you wish you could do more of? Do you get enough trainees to go through? Would you like to have more? As an example, are there other things that you'd like to add to your repertoire?
I really enjoy clinical trial work. I find it's really different work, and I enjoy, we do see clinical trial patients every day. It's not segregated into one kind of day a week. So I really enjoy that part. I do enjoy having residents and medical students as well, especially the ones who are really motivated. When you see that light in their eyes, there's nothing better than that. It just, the whole day gets better. In many ways, I feel that I would love to go back to residency for another week, do different things and really do like a traveling residency where you maybe spend like a week in one place and a week in another place and learn, different techniques and new ideas and exchange your ideas. So that would be really neat. I do see a fair number of kids, and I find that the pediatric dermatology with all the syndromes and different presentations, it's quite challenging. So I wish there was some sort of event for, I don't want to say that I'm quite rural, but people like me who are more isolated to maybe throw these odd cases into some sort of portal and get some help. It is the closest pediatric dermatologist to us is 4 hours away. And with COVID, where it's in Nova Scotia, right? So when the borders were closed, people were reluctant to travel, and understandably. So I do wish that I had a little bit more pediatric dermatology under my belt. Another, I find the area that's really hard and it's evolving rapidly as well as wound care. That's a bit of a challenge for me as well. But you know what? I have great friends and I always ask for help.
That's a very interesting idea of having that kind of thing. It's not virtual, but to actually go, like you say, for a few days. And I know there's so many different things we've gone off. I went to do ultrasound and learn how to do that. And, there's different things, but, you get together with a group of colleagues. That would be really something special to try and organize. And I guess, you could have workshops at Canadian Derm meetings, but if people could get into small groups and work like that, yeah, that's something I think we should try and push. I could see all kinds of advantages of that. The pediatric stuff is frankly scary to me right now. When I think about what it was when I was doing more of it, okay, there were challenges. It was an amazing area, but now it's a language of its own. I did spend some time at the pediatric derm meeting giving a talk on drug reactions, but when I looked at the agenda, I thought most of it was way above my head anyway. So, I'm just happy we have a lot of experts in Toronto, but it seems like an opportunity, even on an experimental level, trying to get some sponsorship to do something like that. I think it's a great idea. And pediatric dermatology would certainly be, it helps build relationships as well. So you feel far more comfortable calling whoever or contacting them if there's a case that you worry that you're missing a syndrome. And I'm sure we do all the time, which is tough. All of that, just so many things. So the clinical trial stuff, that's how are I just want to ask you about the people that you see who you get into a clinical trial. Now, some of them may be people who don't have certain funding for therapies. There may be people who failed other therapies. They can be sort of complicated. But my experience has been, I think when people do, hear about something new, they may not ask all the right questions, but, once they get going, they're like, no one's ever taken care of them like that before, to have all the blood tests and all that stuff. Are you finding that people in the community are sort of lining up to be into a clinical trial?
Well, I find that it depends on the condition and the indication and what treatments have been out there. Looking at the new topical treatments for eczema, which are non-steroidal treatments, we found that there was a lot of interest. Same for new topical psoriasis treatments that are not traditional topical steroids. So there was a lot of interest. But then there are some conditions that are a little bit less known and patients feel a little bit concerned that, well, it's a new treatment. I'm not sure, that I really want to try it. And I do find that most patients actually, almost all who sign up for clinical trial, they're very happy. They're very pleased as they do get that extra attention and extra care. And many do comment how this is so different, and they always get impressed by the size of the binders that we bring into the room and all the assessments. And we often have really great conversations about the new treatments and the medical research. So I find that a lot of the time it goes beyond just the visit.
Yeah, it's good to hear from patients sometimes because even if they explain a concern and you think, where did that come from? And, then once you get a chance to talk about it, which happens more and more, I think during COVID, people have all kinds of concerns, but that's really good. I'm glad you keep doing that. Well, it sounds like, if I might say, you're still having fun.
Absolutely. Every day.
That's the best job. Somebody asked me recently why I decided to go into dermatology. I said there are a lot of reasons, but I have to say one of the things I did when I was in internal medicine was asking people, say people in their 50s, what they were doing. And a lot of people were not, thoracic surgeons weren't having, fun anymore, but dermatologists were having fun. They actually enjoyed what they did and they did a lot for their patients. And it was nowhere near what we can do for people now, the options coming up. So it's a very exciting time. I'm really glad to hear that you're still having fun and enjoying seeing your patients. And it's a wonderful city. It's so nice that you get the opportunity to do that. Do you think your kids are going to go into medicine?
I have a daughter and she had decided to stay away from medicine. So she will be starting an MBA actually this fall. Then we'll see. And you know what? We always been telling her, you have to do what you love. You're going to be happy and successful. And, we all carry that. You have to do what you really love, where your passion is.
No, I think the lesson there is that you're right. The lesson is not necessarily to do. Mom's happy in her job means you need to also be happy in your job. And I think sometimes that gets perverted and people think, I'm happy in my job. Look, I'm having fun doing this. So you should too. They go, no, I should have fun. Thank you. And it is nice to see a glint in their eyes when they talk about these subjects. And it's always good to have an MBA in the family anyways, I suspect.
We always tell her as well that you have to be surrounded by people who are smarter than you. And I feel that in derm, I'm surrounded by brilliant colleagues. And it's been just a tremendous personal, professional growth on a daily, constant basis, right?
Yeah, Yeah, I've always liked to hire people who are smarter than me. And fortunately, there's a lot of room up there. So that's really good, but it really makes a difference. They said, well, the fellows, well, aren't you going to tell me? I said, no, that's a better idea than I had. Please go ahead. And depending where they trained, I mean, especially if you trained in Eastern Europe or something, they're like, they would never say anything against the professor. And that always throws them off when I go, oh, you're right. I think I'm wrong. They're like, is this a trick? and I love that in our system. And I do, as I'm sure you found, that not all places are nationally as collegial as dermatology is in Canada. And I think we're very lucky that we share the successes and pain with each other on an ongoing basis, which is really terrific. Irina, any other last comments you want to make?
Just generally happy to have done this. I was a bit nervous at the start, thinking, oh, gosh, we're going to talk about me. There's nothing to talk about. It was a very fun experience, and I am tremendously grateful for all the support I've had over the years and all the things that I could do, and just tremendously grateful to everyone around and to my patients, to the derma community, and to my family as well.
Thank you so much. Just to sign off, I do want to thank Dr. Irina Turchin so much for taking part in the podcast today, and as also one of my heroes, of somebody who's really been just a strong contributor, an enthusiastic participant, and a role model for anybody who's interested in dermatology or just in caring for other people around them, whether it's just helping a food bank or whatever you're doing. It's that kind of thing that we really all love and respect. Thank you so much, Irina, and enjoy the rest of your vacation.
Thank you for having me.
If you'd like to learn more about Dr. Turchin's practice, please visit www.bdcmed.ca. If you liked this episode, please share it with your friends and colleagues. On our next episode, Neil will welcome another guest from the world of dermatology. To subscribe, go to www.derm.city or find the SLP podcast at Apple iTunes, Stitcher, Spotify, YouTube, or wherever you get your podcasts. Support for the SLP podcast was provided by Leo Pharma Canada. Send your comments to slp@chronicle.org. Until next time, be well.